And so, without further ado, we'll introduce our presenter for this lunchtime, Hilary Wareing. So, Hilary has a background in health research and management, as well as a clinical background as a registered general nurse, midwife, and health visitor. You may well know Hilary through her work as the readiness lead for the National Smoking in Pregnancy Scheme in the last year. And the areas of work that she's currently involved in includes implementing midwifery, continuation of care, developing and implementing sector-led improvement tools, and reducing the prevalence of smoking in pregnancy, secondary care, and mental health. She led the development of Baby Clear, which is an evidence-based whole systems approach, converting the evidence and guidance into practice. So, Hilary, it is over to you.
Thanks, Mark. And here comes the first challenge. I'm just going to share um, my screen so we get some slides up. And Mark, could you just tell me that you can definitely see that?
Sorry, Hilary. Yes, I can. Yeah.
Okay, great. That's my technical challenge over for the day. Thank goodness. Hello, everybody. Thanks for joining us. I'm going to go through a few different areas around using the ICO. The first one's going to be around the why. Why as a service you may want to consider using them, why you might want to consider commissioning them as a commissioner, and then go on to how do I identify where we use them, both as a service, why, how might we allocate them, but also thinking, how do I identify the individuals who might get the most benefit from them? Then moving on to sustainability and thinking about, they've got a cost, but we've also got a cost if we don't support people in the right way and keep them engaged. So how do we balance those things and look in the short term and in the longer term? Obviously, by looking at as well at how we minimize costs. And lastly, but by no means least, I've got some nice quotes to share with you from people who have used the ICO and some thoughts about added benefits, the things we've seen as we've used them that have not been the main intention, but things that have come from making this equipment available to our patients and clients. So, ICO, let's start with the ICO allocation. Who should you consider using them with? Well, see a lot of use in rural areas and areas where there's poor transport links. If it's going to take somebody half an hour to get in, if they haven't actually got public transport or their own transport they can access that matches the times of when your teams can be available, this is going to make it difficult. We're going to set them up to fail in their smoke-free journey rather than set them up for success. So also this can mean if you're going out into those communities to a community venue or to do home visits, you need to think about how much time that is going to take and whether in some situations at some time an ICO is a better use of resources than massive traveling times. So I can't say everybody that's on the call, but I'm thinking about colleagues in places like North Yorkshire and in places like Cornwall. But I might also be thinking about areas like London, where people may be traveling from different boroughs for their health, and that travel can take exceptional time. We have some services that service people across multiple locations. And so, have we really got an expectation that for every meeting they're going to come to us in a central location, or that we're going to go out to them? And again, do we need to think about how we make best use of time and the resources we've got? A lot of our service users at the minute have got serious financial challenges, and public transport doesn't come free. So, are we putting a burden on them that they are not going to be able to meet? or challenging circumstances. It may be that they're a carer and it's complicated to think how they're going to get somebody to look after the person they're caring for while they come to appointments. That might be really difficult. And ours, most likely, they're smokers. They may have other health issues, or they may be pregnant, and they may have lots of other appointments they've got to, and they will start to prioritize where we are as a stop smoking service in that list. And they may not be able to prioritize those meetings. So let's just think about those situations and whether we are setting them up for failure or success. And we've got the challenges in the services, and it's, a mixed picture across the country. But we've got services undergoing transitions. So there may be periods when that service is moving from one provider to another, or it's changing the way it delivers, where it's going to be a struggle to keep the evidence-based support and treatment in place. So you may want to think about using iCOs through those periods just to lessen the burden of how many face-to-face appointments your advisors need to be present for. It could be that the service is being challenged because you've got a vacancy and then somebody goes off sick, and yeah, we're into the flu period, aren't we? This is one of those times when it can be a real challenge during the winter months. So again, we need to think, have we got the number of advisors we need to appropriately support with all face-to-face that's required for our clients? And if we haven't, can we put the iCOs in the mix to help with that? So I'm not always giving the answer here. I think it's about having the conversation. It's about thinking it through, where, when we might use these and for how long. When you've got somebody in front of you, for those of you who are tobacco dependency advisors, stop smoking practitioners in the room, I think my general rule of thumb is that first meeting should be face-to-face, in person. That's because I think it's really important to start building the trust and building that personal relationship. When you ask people who've been through the quit journey, what was the most important thing? It's that relationship with their advisor that has been amazing for them and made the difference. So we need to start to cement that relationship really early. And then I think it's about working out, what is their treatment program going to look like for them? And if you've got the ability to offer iCOs, you can bring that into the discussion. So one of the questions I recommend is, when you've explained what the offer is that you have for them to support them, is there anything that might stop you attending all those appointments in person? Ask the question and listen. If you can set up a treatment program that person feels that they've been involved with, it's been a conversation rather than being imposed, then I would say they are more likely to actually engage in that program and do what they have committed to. And you might ask other questions like, are there any other venues that would be easier for you to attend than where we are now? This is where else we could meet you. Are there different times of day or days of the week that are more difficult or are easier? Is there somebody you could reach out to help during this period, either with transport or caring responsibilities? And when you've had that conversation, it will help you to identify the people where you think, if we can put an ICO with this person, then actually we may be able to offer more consistent care. They may come in for their 4-week quit. They may, we can agree which ones they can come in for and how we can use an iCO and a virtual appointment on WhatsApp so that it's the next best thing and it's actually working for them and working for us. They have got a cost. Everything we do has a cost. So I think to look at how we can employ ICOs in a sustainable way, we also need to ask some other questions. Why are we using them? Is it because you've identified that you've got low CO validation and you think this might help with that? Or are there other reasons we might have low CO validation as well? So to look at what can be solved in other ways, but where we need the ICO to help us with that solution. Thinking about how we deliver our services, about what models commissioned, whether we need to adapt how we offer our services to ensure that we do get better engagement. Thinking about short and long-term ICO requirements. So if you're going to need to purchase them, are you asking your commissioners, this is a short term, we need them because we're in transition. These are the things we're doing that means we won't need them in the future, or we're going to need more at the moment, but we've got a plan in place to adapt our service where, yes, we're always going to need some, might need more now, but this is what we're most likely going to use in the long term. And then outlining the benefits of having them in the system. So the cost benefits of them being there and what might happen if we don't have them, but how we are likely to get more successful long-term quits if we have them in the system as well. And also, obviously, it's going to improve validation, and where you've got the 4-week quit required to be CO validated, it's going to help that contract monitoring as well. So what do people say about them? And I get asked this a lot. What do people think? So this is a random sample. We've done quite a lot of insights work across different projects on this. But the type of things we hear back is, I liked it when I got this, as I could prove that I wasn't smoking. Always worried that when I just said it, they'd think I was cheating. And it's interesting, that comment was made from a service user who they said that about the professional they were working with, not about other people in their network. They liked it when they were asked to blow into the smokealyzer. To start with, I used to like using it more just as a motivator. So that person was using it to remind themselves that, oh my goodness, my reading has gone from 18 to 2. That's amazing. I've done that. That's where you need to keep it. So it helps with that self-talk and self-motivation. Um, a lot of people said something like the next one. It's proving to people that I've done it. And that was around my friends, my partners, my mum, my dad. It's like, look what I've done. And that showing I am telling the truth. I am now somebody who does not smoke. But it also means they get affirmation back from those people. And they also establish themselves as a non-smoker rather than a smoker. So it's establishing their identity as a non-smoker. Spurs me on, gave me the push to carry on. So it's those days when I'm having a wobble and knowing that that level's going to go up, and they don't have to contact the advisor, they can do it for themselves. For some, it was not having to get into the appointment, so no issues about organising work or the children or travelling. The hospital's half an hour away. It was brilliant for that person. Interestingly, we had several of these type of comments. I used it at my mum's too. It showed her smoking affected me and the baby, and it helped her to reduce around me. And that's a bit of one of those added benefits. That's not what it's for, but it does have that impact. And we've heard that from quite a lot of people. I would always prefer face-to-face, but the telephone appointments have been brilliant. And so was having the machine at home. It feels like they're proper appointments. So it's not just about having a telephone call. It is still a face-to-face call, but it's virtual, and I'm still doing the monitoring. So it feels as near as you can get to it, which is really good. that bit about the traffic and being rushed and not feeling ready for the appointment because it's all been really stressful, whereas with the remote, there's less stress. Getting time off work and going to the clinic can be difficult. We have to remember that a lot of the people we're working with may be in low income employment or maybe on 0 hours contracts. And to take time off may not only be difficult to ask their boss for, but may have a huge financial impact for them. It could be losing half a day's pay, which is a lot. So, oh, sorry, next one. Realised I repeated it from the last one, but the last one on here is, so even though I wasn't smoking, I'm still using the machine because I don't want to see the figures go up. So that's about relapse prevention. And that's one of the areas that I think we all struggle with is ensuring people don't go back to smoking. So that moves us on to that added value bit. So motivation, the slip and the relapse management, which is not the reason we give it, but it works for that. What I have seen on this and talking to advisors, what I've heard is that sometimes, even before the next appointment, somebody they're working with will send a message in with their reading on, and it's a higher reading and saying, I need help. And it's a way for a smoker to reach out saying, I've had a slip, I've had a relapse. So it means that they're not waiting for the next appointment, which might be several weeks away, or it might be after they have finished their main part of their quit journey with us, and then they'll send the email, send the reading, and it enables an advisor to reach out and say, how can I help? What can we do? How can we get you back on track? And also using it for affirmation. That was big. I should have put that in big letters. People tell us all the time that they use it to get a well done from other people. We're not really good at giving well dones, yet we all love getting them. And I think what people learn that have got this is they're a really good way for getting that affirmation. And sometimes, again, it will be sending the reading into the advisor and saying, look, it's my reading is still what, 2 or 3, and then the advisor can even just message back and go, yay, that's amazing. And get that affirmation that on that day they are clearly needing. Um, Continue to use the iCOQuit after their journey with us. It will be live with them for a lot longer. As I say, we've not done any concentrated work on it being a relapse, or part of the relapse prevention tools we might have. But what we're hearing is that's how people are using them. And I think it's something in preparing for this webinar, I was having to think about maybe we need to be looking at this a bit more because maybe more formally, we've got a potential use for it here because it needs to stay with them. The iCOQuit is only for one person to use, so they can keep it. We don't need to take it back. So I'm seeing the added value. Where can we actually systematically look for additional benefit from the resource we put to the iCOQuits? And also, again, the secondhand smoke, not the main use, but maybe pregnant woman is spending a lot of time at her mum's during her pregnancy. And if she could show her that her level goes up when she's in that house because her mum is smoking around her, and the difference when that doesn't happen, we've got real potential use for that. Also, maybe somebody who's living with a partner who smokes and they're trying to quit, and they can show the impact around the ACO levels because that's happening around them. So again, an area where we really need to think, how do, there is added value, but how do we as services and advisors make the best of that? I'm just coming to the end of my formal session, so hopefully I have fairly quickly covered why as a service you might use them, and as a commissioner you might think about providing resources to do that. How you might triage people almost into thinking, is this somebody who is going to benefit from this? Is this going to improve the package of care that we can agree with them? How we think about, it not just being a moment in time. You buy 50 ICOs and then they run out, you've used them all and you think, what am I going to do next? Thinking about how we utilize them within a sustainable model, and thinking about, well, they've got a cost, not just the benefits, but those additional benefits that come from having them as part of the package of care you've got. Obviously, we're going to take questions in a bit when Mark's in his bit, but you'll see those are the contact details up. I know that Mark's going to make sure you get those afterwards, but always, grab your phone and take a picture of that slide if that helps, because, there's an urgent need at the moment, but you will be getting the details. Mark, over to you.
Thanks, Hilary. Thank you. Thanks ever so much. That was a great presentation. Some really interesting points for discussion, I'm quite sure. So if you've got any questions, please put them in the chat at the bottom. You can if you just hover over the bottom of the screen, you'll see the Q&A there. So please pop any questions that you've got in there. I can see a couple in there already, and we have had a couple sort of emailed through to us for people who couldn't get on the call because of work commitments. So we'll go through those. We've also got the poll running still. So again, if you wouldn't mind just filling that in if you haven't done so already. I know lots of you already have, so that's really appreciated. Thank you. And again, if you can't find it, it's again on the bottom of the screen. Just click on the More button and then the poll quiz icon, and you'll find it there. So we'll give Hilary a little break, and we're going to just show you the iCO device itself. So I've got one of the devices here, so I'm just going to show you a little bit about the device, and then hopefully this is when it gets really technical. I'm going to try and share my phone screen, and you'll be able to see the app, and hopefully see exactly how it all works. So this is the iCOQuit device. For those who haven't seen it, it comes in a very, very small box, and it's a little sort of handheld device that's got an internal battery. So there's no batteries that need to be replaced in it at all. It's all done via an internal battery there. Now it's a Bluetooth device as well. So the way the device works, not like your traditional CO monitor, which has got the screen on it, which shows the results. This all works via an app on your smartphone. So all the results are shown on the screen on an app. It's all done via Bluetooth, as I said. So obviously you just need to make sure your Bluetooth's turned on your phone and things like that. There's full instructions with the device anyway, but I'll just give you a sort of little idea of the device itself. You can see it's very small. There's the on-off button here. The Bluetooth light is here, so that will show you that that bit's working. There's an exhaust port here, so that will allow any sort of CO from the patient's breath to come out of the device while they're doing the test. So on your phone, once you've downloaded the app, all the little app icons are shown on the box there. You can download them from Apple Play or from Google Play. So for Android, you can have both of them there. There are actually two apps as well. So we have an iCOQuit app. This is just your standard smoking cessation app for your regular. So if you use the Pico CO monitor for your sort of usual smoking cessation service, you can use this app, but we also have a pregnancy app as well. So there are two that can be used. Now, on my phone here, you can see I've got the two apps there. So I'll click on the pregnancy one. That then opens up the app. And you will see on the screen here that I've got to, if you can just see that, I'm sorry, I'm trying to get so there's no glare, but you can see there I've got to sign in. So it's asking me for my email address and my password. When you first open up the app and when you first use the app, you'll have to register your details. Now, there's a few things that you need to put in when you do register your details. You need to put just your name and your age. Then you'll move on to the next section where it'll ask you for your smoking history. And then when you move on to the final section, it will ask you for your contact details, so things like email address. And once you've registered, every time you open up the app again, you will get this screen here. Sorry, it's not very clear, but it's email address and password. So if I just log myself in, okay. And you can see it's very difficult to see, isn't it? I do apologize. This isn't the greatest way to show you. Um, Trying to see if I can do it without a glare there. That's sort of slightly better, maybe. Okay, so you can see on the screen here, um, it tells you your last quit result, which was 1 part per billion, the total days that I've quit, and the total days, the due date that's reached. So obviously, I'm using a pregnancy app at the moment, which is obviously not applicable for me, but it will tell you the due date as well on the pregnancy app. Now, there's a few things you can do on here. You can, if you want to, at the bottom of the screen, you can look at a set of results. So on the screen here, you can see a whole sort of trend graph of results on the screen. So you may have, hopefully at the top here, you'll have sort of the first initial test may be quite high, and then gradually a sort of depreciating graph going down to hopefully somewhere near zero. And the sort of date and times along the bottom of here, so you could, the patient can see that they're performing, they're going through a good quit. The other option that you've got is when you're going onto the dashboard, you can go up to the top corner here of the screen, and you can edit your details here. So there's things like managing profile and things like that. There's also help questions in there as well. The iQuit manuals in there, etc. But you can manage your profile, you can edit details and things like that. But the vast majority of the time, once you've logged in, you'll want to go to the bottom here, which is breath test, and actually performing a test on the device. So you can click on that. It comes up with a little hygiene warning that just saying that the iCOQuit is a single patient use device. It's not recommended that you share the device with anybody else, etc., etc. And you can just continue at that point. And then it will ask you to turn the device on. So at this point, I turn my iCOQuit device on. The Bluetooth light comes on. Hopefully then it comes up with the screen. It just said device detected and connected. It just does a little sort of egg timer connection. And then once that's done, it will then allow you to perform a test. So we can click on the perform test. It's telling you to take a nice big breath in, and then you've got this counting down for 15 seconds on the screen. So they do their breath hold for 15 seconds. Once it gets to zero, the patient can then blow through the device. And then a few seconds later, the app will pick up the reading, and we should get a result on the screen. So 1 part per million. So that just comes straight up on the screen. You've got your green, amber, and red bands as well on the screen. So that just comes as a nice sort of animation on there. We can click on the continue button. It just says on the screen here what that last result was, the total days that I've quit, the date reached, etc. It's back to that sort of home screen. And if I then wanted to send that result to my smoking cessation advisor, I can click on the send button at the top. It will ask me where I want to send it to, so it can be via a WhatsApp message or a text message or an email. So I can click on the sort of email icon here, and it creates an email, which you can then fill in with the email details at the top. And you can see automatically filled in on the email is my last reading was 1 part per billion. And then you can just sort of sign that off there and send that as an email. So it's a pretty sort of straightforward app to use. There's not too much that you can do with it, and too much to get sort of overcomplicated about. You just have to just register the app in the first instance, make sure that you've got all the details on there. And then every time they actually look at that they want to send, the patient wants to send a result to you, they just log into the app again, usually go straight to the breath test icon, connect the device up, perform the test, and then email or text or WhatsApp the results to you, and then you've got a record of it. And then you just sort of come out of the app, and then that's the end of the test. So it's pretty sort of straightforward. I'm sorry it didn't quite appear on the screen as we'd hoped it would do, but that's technology for you. It always sort of messes up at the most inopportune point. So, um, Hilary, I think we've got some questions in the Q&A. We've got quite a few in there now.
Yeah, I've
Um,
just been having a quick look at them while you were showing the technology. I think there's quite a nice mix for you and me. And I've also got a couple on my email that people have just sent me who haven't been able to make the webinar as well.
Fabulous. Okay. So I can see a couple already just about pricing.
Yeah,
The cost of the device, we do a different costing depending on how many you buy. So if you were just going to buy one device, they cost about £70 plus VAT. If you're going to buy multiple devices, the more you buy, the cheaper they get. So if you just contact us, if you work on somewhere between sort of 60 and £70, depending on how many you buy, but contact us with what your needs are, and we can give you a dedicated price and quote from us. Um, the another question that's come up about the platform used for video calls. That's a really good point. The ideal way of doing this test would be to have a Teams call with somebody and get them to do the test in front of you via their phone and then send you the results so you know that they're doing the test. The app, you can't do the video call via the phone while the app is working as well. So it has to be done via Teams on perhaps a laptop or an iPad or something like that. So I think probably, would you say Teams is probably the best one, Hilary? I think that seems to be the NHS one that seems to be the most.
yeah. I
Um,
I think it's great for the professional, but sometimes it's about working out with the person you're going to be using it with,
yeah, correct.
um, to think about what platform they can access. I also think, to not always over worry if they're not doing the breath test and you can see them. It's a bit of an interesting one because I get why we might want to see them actually doing it at that moment.
Mm,
But one of the things that came up in some of the insights we gathered was that, yeah, those people that are working with us sometimes think they are lying, and that they might give a wrong reading. Whereas what we had back from them was we would only be cheating ourselves at that stage. So I think what we should do, if it's not possible to get that synced, is to trust the people we're working with and the relationship we have with them. I really have seen, well, in fact, I haven't seen gaming. I'm not going to say it's not there because, of course, people might do it. But in our experience and in our research, people feel that they're being honest, but there's a perception that we might think as advisors they're not being honest.
yeah, no, that makes perfect sense, doesn't it? I can see, sorry, one of the questions about somebody asking about the cost, it was Sharon. She was asking about the cost, but also about the length of time the device lasts for. So when the device is activated, it should last for 12 months I think it's 12 months or 500 tests. I mean, clearly you're not going to do 500 tests, but 12 months should be plenty. If you're having a device that's not lasting that long, please do get in touch with us and we can look into that. But they should last for that long. The internal battery, certainly should last that long once it's been activated. So yeah, just get in touch with us if that's been an issue for you.
Yeah. I think also that it is that 500 uses, which should be more than enough.
Mm,
And it is really important to say it's for their use and nobody else's.
yeah,
Because we kind of know sometimes this gets passed around because you hear little stories going on. So I think it's really important for the advisors to say they're for only their use and explain why, why it's about that safety, because unlike the breathalyzers we're using, the professionals are using in the clinical setting, we're not changing mouthpieces, we are not cleaning between each use in the same way.
yeah, and that sort of leads on to one of the other questions I've seen from Sarah, about would it not be better to be able to change the battery and perhaps have disposable consumables and consumables with them, but they're single patient use devices. So that's the reason why you don't have the mouthpieces to go with them as well. So you can just blow into the device as it is. Um,
I've got, shall I just pop it with one, which
yeah,
is from somebody who couldn't get here? They asked what stage should you give an ICO to a patient or a client? So what stage of their quit journey? I thought that was a really good question. Um, they said, should it be before they quit, after they put it, when? Well, my view is you certainly have the first visit face to, contact face to face. I'd struggle to think why we can't do that. Um, and my view is I would have put a plan together which says we can start using this when you're actually on the quit journey. So they should have had at least they're setting a quit journey day before you give it to them. And it might mean, it's different times after that. So if you've got somebody who thinks, look, I can manage those first few weeks while I'm doing my 4 week quit, coming to see you, but then I'm going to start struggling, then think, okay, maybe I just delay, see how they're going with the quit, and then give it to them. So it's just being a little bit responsible with the equipment. So we're not giving it to people who actually never end up going on that journey. But also, if you can give it face to face, then you can say, shall we set it up now? Let's do it together. You can become really practiced at it. That takes any stress out of it, and it make it, you can make sure that they're fine and they understand it, so that literally as they go out the door, they're up and off and using it. So that can be really disadvantageous. But it may be you're halfway through the quit journey and somebody says, I've got a major problem at home and I'm not going to be able to get in. And that it also most likely links with somebody else's question about how do you get them to them. Well, preferably you hand it. It's a gift from you as the provider to that your client. But if not, it's either send it out through the post. Somebody asked how big it is. That big? That's about it, isn't it? It goes through a post box. I know that
yeah,
well. I've sent so many out.
yeah. It's a very, very small
Well, yeah.
box, so it can just be, yeah, put in the
And,
normal post.
yeah, and it's fairly light.
Yeah, it's very, very,
Um,
yeah,
But the other way is if perhaps there's a centre where you go out to where you do some quit smoking in the community that smoker lives, then it might be that you just want one or two at that centre so you can say to somebody, do you know what? Just nip down to the family hub and go and grab one. I'll just tell them you're coming in. You don't want a lot in the cupboard because you don't want them timing out. Um, but just have a couple in a few places where people could get to really easily. The whole rule is we're trying to make it easy for people to stay on the journey. So think what can we do to do that and also minimize the costs of the service.
yeah, absolutely. A couple of sort of practical questions. Michelle's asked if about having they've tried to use it on a 17-year-old who's not really able to use the app
Mhm.
because it wouldn't allow her to download it because of her age. Can that be changed? Um, I don't know is my honest answer.
I can pick that up slightly because I've raised it with Bedfont who make
Yeah.
them, and it's about the whole MHRA approval, but they have gone to have a look at it
Okay.
because we've had it raised a few times now, particularly for young pregnant women. So it is raised, and that question is in the system.
Fabulous. Great, thank you for that, Hilary. Does the client have to log in every time they use the app? They do, unfortunately. Yeah, it's it's a bit annoying, but yeah, you do have to just log in each time. Um, do we have a tutorial video we can text to clients? There are online videos that Bedfont have. They are on the Bedfont website, so you can find them on there. They do have sort of I think they're kind of like quite animated videos, but they do go through the sort of use of the device on there, so you can go on there. If I think if you actually even just Google iCOQuit and Bedfont video, that comes up pretty much straight away. So that should take you to the right page. Um, if we're doing a WhatsApp FaceTime, do they need to share? Yeah, I think this is the question from Eve. It's that sort of trying to use WhatsApp at the same time as the iCoQuit device on at the same time. It won't allow you to do it, I don't think. So so it's probably better um, to yeah just do the test and show it on a Teams call or something like that if that's possible.
Yeah.
Um,
I've just seen an interesting one here from Emma on here that's really current about respiratory teams when patients need to be smoke-free before setting up home oxygen. And interestingly, we're literally just been having a discussion the end of last week about patients who need oxygen and vapes. So we were looking at swap to stop to see if that would help. So yeah, and in fact, the oxygen suppliers were talking, and fire and rescue were talking about the need to be absolutely certain that somebody isn't smoking when they're giving them the oxygen. I suppose you could use the ICOs. I'd be saying that those people who are going in to do those assessments maybe should be carrying a breathalyzer. And certainly some of our fire and rescue teams are starting to carry them. So you could leave it with them, but I think, yeah, I'd want that team to have a breathalyzer. I don't know what you think, Mark.
no, I agree. Yeah, totally. Yeah, I 100% agree.
Yeah. And I think most likely, thinking about the economy of it, that most likely would be the better option.
Yeah. There's a couple of questions about disposal of the ICO and things like that after it's been finished with. I mean, they can be disposed of in the waste, the waste, electronic waste. I can't remember what it stands for, but your medical engineering, if you've got access to that, can dispose of them. If you haven't, you can send them back to us if you want to, and we can get them disposed of. But yeah, we can get those sorted out.
Yeah.
Does the machine make a noise if it blows too high? No, it doesn't, I don't think. I'm pretty sure it doesn't. It just comes up on the screen. You'll be able to see it and it'll come up in, if it's obviously very high, it'll come up as red.
Right. Yeah. Um,
Um, so
somebody's
go
just asking if there's any examples of services. I think, and you'll correct me if I'm wrong, but most likely this is has ended up being most used in pregnancy care. I would think that that's one of the key areas. So if you want to talk to a service who's using them, if you look at the maternity tobacco dependency services who are involved in the incentive scheme, many of them to some extent are using the ICOs and they're broadly used across Greater Manchester as well.
fabulous. So yeah, a couple of people, Sarah, thank you for just confirming. Actually, you can use WhatsApp and ask the client to share their screen, and that shows up on the
Yeah,
video call. Well, I think that's what I was kind of trying to do on on Zoom, but for
yeah,
some reason it just wouldn't connect up. So a couple of people have said that. So thank you, Sarah, and Tolu has also said that as well.
yeah. Oh, there you go. Somerset. Sorry, I forgot about you, Somerset. I shouldn't really, should I? Somerset are using them. Beg your pardon.
Um, are there any platforms that you can use for video calls? I think yeah, it's difficult. I think WhatsApp sounds like it's the best one to use by the sounds of it.
I think
Um,
it's the one that many families use. They have
yeah,
WhatsApp groups, they WhatsApp their friends. It's just so widely used and it's accepted by the NHS.
yeah, no, that's fine. Cleaning is another one. You can just clean the device just on the outside of it, just give it a wipe on the outside, just with just a normal sort of damp cloth. It is your own personal CO monitor, so you're not sort of sharing it between people anyway, so you haven't got that sort of infection control risk. But you can just wipe it with a normal cloth. We don't recommend anything to do with alcohol or alco wipes or anything like that. So please don't use those because they can affect the readings. Um, I was trying to think, do they stop working at the expiry date quoted on the box? No, they won't stop working as long as you've activated it by that expiry date. That will then last for 12 months. Yeah, it just needs to be activated by then. Um, yeah,
And
more,
if I'm honest, well, because yeah, we have them in here and all sorts of things. They quite often last quite a bit longer than that.
hmm.
It does depend on how many blows in that time as well, doesn't it?
Yeah. People are asking as well about a few people have just mentioned about sometimes having connection issues, and particularly with Android. I think Android's a difficult one for we don't just sort of do the Bedfont devices. We do lots of things with spirometry, and one of those is remote spirometry. And Android is always a really difficult one because there are so many Android devices and so many makes and models, and there's thousands of them. So there are always going to be some Android devices that might not work, and particularly if they are old devices, they might not have the sort of correct sort of firmware inside to make it work. But iPhone's a lot easier because it's a fairly sort of straightforward sort of setup. So yeah, there are going to be some people who do have issues
Yeah,
with Android, but hopefully most won't. If you do have any issues, they can contact our support, our technical support, and see if they can help. And it's not on that list at the end, but our technical support is support@intermedical.co.uk.
yeah, yeah.
So it's the same email as everybody else, but support at the front.
Yeah. And an interesting one on that, Mark, that some maternity services now, in fact, I was with one on Monday that were doing this. Actually, if you're thinking about it for pregnancy in particular, but this may be happening in other services as well, um, if the woman has not got an iPhone, not got a phone, or not got a phone that enables them to access things like advice on the phone and tools and their records, they give them a SIM card for their pregnancy, and they link with a charity that provides the phones. And so the women actually get a phone for their journey,
That's good, isn't
which
it?
is absolutely excellent because
Mm.
we do have that group in in society that just have not got the phone they need in order to get the same kind of benefit from what we can offer, whether it be other services or this. So it is worth asking locally whether anybody's engaging with this. It seems to be starting to take off. And the fact that we've got charities who can provide those secondhand phones is a real benefit. So don't
Mm.
just always think, well, they haven't got it, so we can't do it. Ask in your organisations because something like that may be possible.
Fantastic. Yeah, that's really good to know, isn't it? I think that's a really good service
Yeah.
that charities can offer. Sort of getting to the end of time, but I'll try and do another couple of quick ones quickly. Emma's asked once a patient's finished with it, can you then give it to another patient? Not really, because it's a single patient use device. £70 a patient's a lot. Um, it depends, I suppose, on how you look at it, but it's a single patient device, unfortunately. So yeah, it would need to be disposed of after that. Um, a lot of Bluetooth devices have tracking on them. Does this track? I don't believe it does. So no, that is the answer to that one. Um, are there different apps for pregnancy and non-pregnant? Yes. So on my phone, if I just very quickly show you. You should be able to see, hopefully on my screen there's a pregnancy app at the bottom, which is the pink one, and then the blue one is the standard app. So one's called iCOQuit and one's called iCOQuit. I think it's called Mums to Be. Yeah. So there's two on there. But if you just put iCOQuit into your search on your app store, you'll find it.
Yeah. Oh, and one asked there, which I think I know the answer to, is it water resistant? And the guess is no.
Yeah, yeah, I think there'd be most. There's always a question about watches, isn't there? Is it water resistant or waterproof? Yeah, I think the advice would be just try not to get
Keep it
it
dry.
too wet. You can obviously wipe it over with a damp cloth, that's fine. But if it gets very wet, then it could damage the device. Can you offer a buyback scheme for used devices when they're returned? No, we can't. Unfortunately, we can't use them. It's just not something we can do. Unfortunately, there's no way we can reuse them. Um, we need to use personal phone to do this at work. Nobody else will have it set up. Yeah, so if you haven't got a work phone, then yeah, you might have to put it on your personal phone. So yeah,
Oh,
it's how you can do it really.
oh, and just a quick, I know we're coming to them, but a quick one there for somebody. Why have we got different for pregnancy and non-pregnant? That's because of the changes in metabolism uh, within pregnant women, they will blow a lower parts per million for the same level of exposure. So
Mm.
not just it's not that level's not just different on these devices, it's different within NICE guidance and it's different across the other devices as well.
Yeah. So, and Sharon's asked that this doesn't go through a usual prescription. The surgery has to buy them. Well, I guess so. Yeah. I don't know if the local stop smoking service would help with that and maybe donate them. I suspect not, but I'm not 100% sure. You'd have to ask
Yeah.
them. But
Yeah,
yeah,
we
yeah,
have the the stop smoking service grant again next year.
yeah,
So I would say that, make your case to,
yeah.
talk to the key person at the local authority, the tobacco control lead, and have that conversation to whether that's possible.
Just one more question. Do the professionals have access to the patient's CO history? Well, yeah, I think you can send the trend or certainly a screenshot of that trend graph. So you can send that through. And obviously, if the patient's sending you their results regularly, you can keep a track of it that way. But that's the way you can do it. I think we better
Yeah,
leave the questions there because we've just gone past half past. Hilary, if you wouldn't mind just putting that final slide back up again, just so we've got the contact details.
yeah,
Um, and you can also see Hilary's contact details on there as well. If you want to contact Hilary for any advice and the work that she does, she'd be more than happy to speak to you. But yes, I'm afraid we're running out of time. I do apologize for the technical difficulties of sharing the screen on the phone. That would be probably my fault because I probably didn't do it correctly. But hopefully, if we do another one, I'll make sure I've got that sorted out perfectly. But I do hope you've enjoyed it and you found it useful. I'm going to ask you just one more time if you haven't already done so. If you could just fill in that poll at the bottom, that would be fantastic. But finally, just once again, a huge thank you to our speaker, Hilary Wareing. Thank you so much, Hilary. We really appreciate your time today. And also a big thank you to everybody else who has attended and giving up an hour of your precious day. And we do really appreciate it. Get in touch via those email addresses, sales at for any product or inquiries or training, marketing at intermedical.co.uk for attendance certificates, or if you need support, it's support at. But they are all on the screen anyway. Yeah, and we'll let you get on with your day. So thank you ever so much again, and have a good rest of your day. Thank you, everybody.
bye.